Hello, I'm Charlyne Martin. Welcome to Something to Talk About. Well, fall is almost here, and it's time for new looks. At least that's what happens to me in the fall. I'm always saying, got to get a new look. And so there are other ways to get new looks also. Most of us want to get rid of frown lines and crow's feet and all of those kind of things as we search for the fountain of youth. Well, my guest today is a returning guest. Dr. LaKimerly Coates from Rockford Dermatology is back with us to talk about how to bring back the fountain of youth. Welcome to Something to Talk About.
Thank you for having me again.
Oh, yes, yes. I mean, there's so much to talk about with skin and skin care and new looks and things that we thought we couldn't afford, but we find out
it's accessible.
We can.
Yes, yes.
Well, because we have a lot to get into, I don't want to leave anything out. Let's get started. First of all, one of the things that a potential client should always ask is what are your qualifications and how long have you been doing what I'm going to call the injectables?
Yes, perfect name. I am a board-certified dermatologist, and it's kind of what we touched on last visit, where a board-certified dermatologist or a board-certified plastic surgeon are the best injectors, or people that are trained and working under them, because there are actually also nurse injectors as well. But again, I feel that it should be in a board-certified dermatologist or a board-certified plastic surgeon's office. That's where you're going to get, I think, the best outcome.
Okay.
And I personally have been injecting, I don't want to reveal it necessarily, but we'll just say the late 90s.
Well, you look gorgeous, and here it is, 2016, so I have a feeling that most of this is natural.
Thank you, thank you.
Now, we talk about, people all hear about facelifts and all of those type of things. So can we look at Botox and fillers as an alternative to surgery?
Well, it's something where if you're not ready to go up under the knife, so to speak, if you're not ready for aggressive therapies, injectables or fillers and Botox injections are a great way to enhance your natural beauty non-invasively, meaning, or non-surgically, I should say, and still have a great outcome.
Okay, so here's the good question. What areas of the body do clients come in that would qualify for an injectable as opposed to surgery?
Okay, so basically the way we look at it is the muscles kind of at eye level or above, those muscles react best to being relaxed. And so Botox is something that we use to relax those muscles of facial expression around the eyes, as you mentioned, the crow's feet, and above. Around the mouth, Juvederm is the best injectable or filler for that area, because it's not so much that these are lines of motion, they're more lines of relaxation, or at rest we see these lines more so, and so what we want to do is fill in those lines. And then we have something newer on the market called Voluma, which is in the same family as the Juvederm, as it is a hyaluronic acid filler, and it's something where it can actually lift the cheekbones and kind of fill in this area that tends to want to go down a little bit as we mature.
Okay. So we can do a lot of face stuff.
There are a lot of fun things to do with the face, short of surgery, that can give you 10 years or more.
Okay. What do you need to know about a client's medical history, or do you need to know about their medical history when they come in for consultation?
Always part of our consultation is just a general medical history. For example, with the Botox, if you have a neuromuscular disease or like a history of, for example, multiple sclerosis, you're not a candidate for the Botox because it is a muscle relaxant. That's something that works on nerve endings. And so that is not the facial rejuvenation for you if you have any neuromuscular diseases. For example, I'm interested in any easy bruising, if you're on any blood thinners when we're doing the Juvederm or Voluma, or even the Botox. It's not a contraindication, meaning you can still have the procedure, but you just want to understand that you're at slightly more risk for one of the side effects, which is bruising.
Okay, okay. Does age matter?
Oh.
I mean, if you're in your 20s, are there things that you would recommend doing, or 30s, all the way up to 60 plus? I mean, does age really matter?
I say no, it does not, because I've treated women and men of all ages in their 20s who have, for example, maybe a very deep frown line already developed. I have patients that are in their 70s that they receive Botox, fillers. So age is just a number. It's something where it's about what your desire is in terms of where you want to be improved, basically, and we can make that happen.
Okay, and you mentioned men.
Yes.
You know, and that's interesting because oftentimes, now movie stars are a whole nother species.
Yes.
You know, I'm sure the men are getting injected and pulled and stretched as much as the women, if not more. But for the average person, do you get a lot of men who come in?
I would love to see more male patients, of course, but oftentimes they're a little shy when it comes to doctor visits in general. And then when it comes to cosmetic services, I think that they're a little hesitant, but once they come into the office and see how comfortable the environment is and that these services are not for women only, that we can meet their needs, they're very pleased with the outcome.
Well, that's good. I like to be equal opportunity here,
Yes.
and oftentimes men are really not thought of when it comes to using cosmetics and getting enhancements and that sort of thing. But the ordinary common man can benefit from some of these treatments also.
Exactly, and they have areas of concern that can be improved upon, and just like with women, it improves your self-image, it improves your self-confidence, it just makes you feel good about yourself, and so they're deserving of that as well.
And we talk about self-improvement, and there are people who tend to believe that doing any of this stuff is vanity and it's, being self-centered, but the self-esteem issue is really important.
I agree. I
Really
agree.
important.
We can't emphasize that enough, and especially when we think of people in the workforce, for example. We're working at more mature ages, and we're having to compete with younger people for these positions, and so it's not just a vanity issue. Sometimes it's a financial issue. Women oftentimes have to go back into the workplace, maybe after having children or after a divorce situation, and they want to be physically able to I'm lost on that one, sorry, but to be able to compete,
Sure.
I guess, in a younger job market.
And you know what, and that's really valid because in this country, we are a youth-oriented society.
Yes.
And other cultures, they venerate their elders, and you can't have enough wrinkles, to give you that status. But here in our society, it's the complete flip.
Yes.
They talk about the 60s being the new 40s, or those type of things, and therefore, I mean, it has good value in some cases.
Yes.
Because it means that if you're 60 or over, you may hit the gym a little bit more.
Exactly.
So there is an upside to saying I need to look better, take better care of myself, because after all, the 60s is the new 40s, and you got to get out there and get some of those very well-earned lines removed.
Exactly. Well, and it's all part of the presentation. I think when we were talking about like the 60s or the new 40s, it's something where you dress differently. You don't necessarily dress the way your grandmother did when she was 60. We tend to also take better care of ourselves. We eat differently than our grandparents or great-grandparents did in some ways. And so it's something where we're trying to figure out where we can improve the most, and this is just another tool at our hands to have improvement, to have kind of options and choices to basically be the best you can be.
I like that. There are tools out there, and that's the way I like to look at it. It's, oh, why do you wear makeup? It's just another tool. I like painting the canvas every day to go out with a best face that I think I can put on. And plus, it has the protection from the environment on your skin. Those type of things, when you start to put them into focus. It takes less concentration on, oh, it's vanity, oh, it's, overblown self-esteem or narcissistic or any of those negative connotations that really are outmoded.
Exactly, exactly. And when we're talking that, when you mentioned protection, that made me think, if you're going to take the time to invest in things like the Botox or the fillers, Juvederm, Voluma, you want to protect your skin. And so sunscreen matters. I had to get my plug in. Sunscreen. We still want to protect, because really a lot of what we're talking about in terms of the signs of aging, it's not just aging, it's really sun damage to the skin. The sun is breaking down our collagen. Our dermis, or that thicker layer of our skin, is thinner because of all the ultraviolet damage. And so it's something where these fillers are just about replacing some of that volume that we lose due to the sun damage, but you really want to protect. And I think you get a better result if you're using your SPF 30 or higher with the zinc every day.
And when you said every day, that means fall, winter.
Exactly.
Winter, the reflection of the sun off of snow and ice, you're still getting sunlight.
Exactly, and fewer leaves to shade you, so you have a double whammy.
Well, there's probably a triple threat, because with our thinning ozone layer, we're getting hit with more ultraviolet rays than ever before.
Exactly.
And that's not the goofy science that somebody's saying, oh, well, the Earth is not. Well, it's probably a natural occurrence for the Earth. I mean, that's my take on it. But it's happening.
The Earth is aging too.
Yes. Yes.
Our environment.
Yes.
And so it's all about the things that we can do to combat this process and
Absolutely.
to kind of make improvements where we can.
Yes, and there is no age to where you don't need to try to protect your skin.
Exactly. And there's no age that you can't improve.
Okay, well, we need to hammer that across, because
yes.
it's good for you.
It is.
It's really good for you to take care of yourself. And however you define that, and there are the tools that can help you take your defining moments wherever you want to take them.
Exactly. Exactly.
Well, let's get back to, we're throwing out these words, fillers and Botox. And another question, do you show your clients before and after pictures? Do you show them pictures of other patients that have had successful outcomes?
Yes. Well, I think that's very important to also be able to have a realistic expectation, I think. And so that helps. The before and after photos definitely help with kind of giving a realistic idea of the outcome that we're looking for.
Okay, that was my next question about client expectations, because, my experience with going to beauticians and getting your hair done is sometimes the expectation is way beyond the reality. And I can just imagine that that's probably can happen going to get, enhancements or whatever, is that someone walks in and imagine that their face is going to look like it did when they were 20 and they're already 60, and there's a breakdown there somewhere between what's for real and what isn't.
And that's where the consultation is really important. What I try to do is to really understand and try to hear what it is that the patient wants to change, and then try to show them how we can make that happen, but realistically. You're not going to look like you're 20, and the 20s were kind of overrated anyway. We just want to be the best 60 we can be, or the best 50 we can be, the best 70 we can be. And so that is, you're exactly right, that you're not going to look like you're 20, but you're going to look better. You're going to have a smoother or softer look. My goal is always to create a natural appearance. Where people aren't looking at you and thinking, oh my gosh, what did she do to her lips? Or as I say, I really always try to avoid trout pout.
I was going to say that, trout mouth.
Yes, that is not flattering for anyone, despite what Hollywood tries to show us. And so my goal is always just natural beauty, just enhancing If your lips have thinned some over time, which is totally natural, we can just enhance that without an artificial appearance. If you have lines around the mouth, we can soften them. Will they totally 100% disappear? No, that's not the goal, because then you don't look like yourself. But if we soften those lines, you're you, but younger. You're you, but refreshed. You're you, but you look rested. That's the goal, natural beauty.
Oh, now that was the word I was thinking of, is looking refreshed.
Yes.
That you've had years of 8 to 9 hours of sleep.
Exactly.
You know, that's the look that's achievable. That's the look that I think is the best.
Yes.
And, you know, I think we've all experienced on TV the women who look more as if they're joining the circus than walking around amongst normal people.
Yes.
It's like putting a film of Vaseline on a camera lens and pulling back so that you have blurred lines.
Exactly. That's exactly what we do. We're kind of blurring, fading them, softening them. So it's natural that you don't look manipulated as the goal.
You mean you're not going to do the Kenny Rogers thing that suddenly he looks as if he was born and raised in China?
No,
And
we
that
avoid
he's of Chinese extraction even?
we avoid that, or even the extreme. I always think of the Jackson family, who it's like it's sometimes too much of a good thing is not beneficial, and so it's really important to be you and to love you, to appreciate you, and just still understand that it can always be enhanced, it can always be improved. We always have goals for our lives. We can have goals for our physical appearance. Just like we exercise at the gym, it's the same concept. It's all about just enhancing and improving and really just being the you want to see in the mirror, that you envision as your best.
I like that. I really like that, because I think that's probably scares a lot of people away
Yes.
from even thinking of getting an enhancement, because they're afraid that they're going to look like someone else and not recognize themselves. I mean, now for those who are really into, like the Jacksons, who really want to look like, I don't know what they wanted to look like. I hesitate to say what they wanted to look like. But for most normal people, you just want to look good.
Yes.
And you want to feel good.
Exactly.
And to be able to do that with the least amount of effort, and that brings up another question about effort. Does it hurt?
I was just going to tell you, because I think you're exactly right. The number one reason that people don't pursue cosmetic services is because they're afraid of the outcome. But then the number two is pain or discomfort, or how much am I going, or how bruised, or like how much is my appearance going to be altered, the downtime kind of question. So it's not miserable at all. Yes, these are injectables, so yes, we are talking about a needle, but we have different techniques to make it more comfortable. For example, when I inject a filler, I always apply a topical numbing cream prior to the procedure. It's part of what we do as your initial intake into the day of treatment. We have all of the consents, we take photographs, and then we apply a numbing cream to take that edge off of the pokiness or the sharpness of the needle. And then, fortunately, now the company has included a numbing lidocaine cream or a lidocaine solution as part of the hyaluronic acid, which is the complex that makes the juvederm and the voluma. So as I inject, or as I fill in those lines, when I go back over a certain area, it's pretty much numb. So there's a little initial discomfort, but nothing that I can't work through. With most of my patients, they're fine.
Well, that's really good to know. I mean, we want to look good, but we really don't want to hurt doing it. For instance, I don't want to really exercise to get my muscles in shape, because the next day it's going to hurt.
Cool Sculpt.
Oh, that's right, Cool Sculpt. How can I forget that?
I know.
It's the permanent way to get rid of the fat cells that you don't need anyway.
Exactly. And then, well, that's another, when we talk about permanent things, cool sculpting is permanently removing that fat. But these injectables that we're talking about, part of the beauty of them, I feel, is that they're not permanent. These things will, over time, gradually fade and go back to kind of the baseline to some degree. So it's something where you don't have to worry that you're altering this permanently, and what if you don't like it? It's not a permanent change. It's something that you will have to come back for.
And speaking of that, how long, okay, I know there's probably different, with different people, your body is basically absorbing this stuff and disseminating it and getting rid of it over time. Mm-hmm. But what is the usual time, say if a person, say got some Botox or Juvederm?
And so with the Botox, for example, the average amount of time that it lasts is about 3 months for that initial treatment. What I found in my practice, though, is that with repeated injection, most of my patients are able to only come maybe every 4 to 6 months. And as you mentioned, it's really about your individual body chemistry and how quickly you metabolize it and how quickly you're making these neurotransmitters to replace the ones that are now relaxed. And so it's something where everyone's a little different, but on average, with repeated injection, 4 to 6 months for the Botox. But the beauty is the Juvederm is 1 year. Oh. And that one is really nice. And the Voluma is even better. It's 2 years.
Oh, wow.
Yes. And so it's something where not permanent, but you do get a very good value of it.
Okay. Mm-hmm. Okay. And you know, we're throwing out these words: Botox, fillers, Juvederm, and well, you see, I did my homework.
Yes, you did.
But we need to help others to understand what are we talking about.
Okay.
So let's talk about Botox. What is Botox and how is it used? And we'll talk about contraindications about that.
Okay, very good. So with the Botox, that is used to relax muscles. And so it is something that is a neuromuscular relaxant. It's something that's used in neurology as well as cosmetically to help those muscles that are contracting stop doing that, temporarily relax them so that the skin over the muscle that has been folding repeatedly to the point where it has now this deep line where that skin is allowed to rest. And when the skin rests, then that line softens. For some, it doesn't totally soften, so that's when maybe I'll come back over the Botox and use a little bit of filler if the line is too deep. But for many, just allowing that skin to relax and not having that muscular contraction is enough for that nice smooth forehead or those nice like soft smile lines that aren't too deep at rest.
Okay. Mm-hmm. And you know, I think most people have heard of the word botulism.
Yes.
Now, is there a relationship between botulism and Botox? And let's talk about the whole organism.
Protein.
Yeah.
And so basically what they have done in the Allergan company is inactivate the toxin part of it, so it's no longer a poisonous botulism poisoning kind of thing.
Right, you're not going to get botulism.
No. It's something though where they have taken that component, that protein that does relax the muscle, and that's where they focus, but but they've made it an inactive protein where it's still able to relax the muscles but not going to have a toxic effect.
Okay, because I've heard people say, you're injecting this toxin into one's body, but no.
It's a neuromuscular relaxant or a protein.
Okay, and we did mention that it is, there's some other condition that I did hear that they're using Botox for, but I can't recall what that is exactly right now, but it's not just used for
cosmetic. Neurology uses it for various conditions that the muscles are spasming, and so it's something that they inject much higher quantities, a much higher concentration than we do. We are just very mild. I always in one where I rather treat again If we haven't totally relaxed that muscle, I'd rather add more than have so much that people have that frozen appearance. It's important to me, as part of my personal outcome, to have some movement. You want to not look totally frozen, but you want to look relaxed.
Exactly.
But you still have just a little bit of motion so that people aren't like, oh, she had Botox.
Right.
Some people like the frozen look, and if that's what you like, I can do that for you. But my own preference is just more of a softening, just a relaxation of those muscles.
Okay, and now let's get into fillers.
Yes.
What are fillers? What are they composed of?
Years ago, we used something called collagen, which was like either from an animal or a man-made substance, and we would have to test and make sure people weren't allergic to it. But now, in this era, we have hyaluronic acid, and hyaluronic acid is actually in our bodies. It's something that our cells, and we already have it in there, and so all we're doing with the Juvederm and the Voluma is just kind of adding back what's kind of depleted or a little low. And so because it is a natural substance to our bodies, we don't have those allergic types reactions to it. And for most people, that's why they're able to have it in there for a year, 2 years, because our body's not looking up on it as something foreign, but rather something that is part of our normal makeup.
Okay, and this is relatively, I've been hearing the term, of course, you know, they're advertising that certain cosmetic creams and all of this stuff,
yes.
you know, has a hyaluronic, say it for me again.
Hyaluronic acid.
Hyaluronic acid, and I know that they're also using it to inject in knees and in joints, you know, to help with the mobility, because as you said, it's a natural substance.
Yes.
Go ahead.
Oh, I was going to say, and it's hydrophilic. It attracts water to that area, and so that's part of how it fills in these spaces, is it kind of keeps that area moist. And so that's why I love doing lips, for example. You'll find like over time our lips are a little drier, and so sometimes if someone has a medical condition called pearlash, for example, where they are having a lot of moisture and yeast, dry and peeling in the corners of their mouth, even though it's a medical condition, it's treated wonderfully with the cosmetic filler Juvederm, because what I can do is fill in this area so that the corners of the mouth aren't attracting the saliva as much, so we don't have as much yeast. But then the moisture that the hyaluronic acid brings to the area, no peeling, you know, it just beautifully corrects this medical condition.
Okay, we're at the halfway mark.
Oh.
And stay with us. We'll be right back for this exciting conversation about bringing Hollywood into your own home so that you too can look like a movie star. No, better, you'll look like yourself. So come back.
What do all these people have in common? They all graduated from Rockford area schools. Rock forward!
Welcome back to Something to Talk About, where my guest today is Dr. LaKimerly Coates from Rockford Dermatology, and we're talking about Botox and fillers and things to make us look fresh and relaxed. So let's just get back to this conversation. And so we were getting into softening lines around the mouth and making sure that we don't have people walking around with trout pout and and frozen foreheads and that sort of thing. That your aim is for a natural, refreshed, relaxed look.
Exactly.
Yeah, just for those of you who don't get away on vacations, just think about what you would look like relaxed.
Yes, we don't want to have any Halloween incidents where people or we think it's your costume and it's just you.
Oh, I love that mask. This
Always
is my face.
Always natural. And then when you talk about vacation, it's not as expensive as a vacation, so you can have that refreshed look for less than a trip to the Caribbean.
Well, we'll get into that because I'm sure that people are thinking, okay, now how much is all this relaxed face is going to cost me? So we'll get into that, but we got some other stuff here that I would really like to try to get in. Are treatments different for men than they are for women?
Oftentimes, my male patients, because men in general have stronger muscles and their anatomy is slightly different in terms of what we want to enhance or improve upon, yes, there are slightly different approaches. For example, for the muscles around a man's eyes, when we're trying to get rid of that deep frown line, I will go up a little higher with the amount of Botox or the concentration of Botox that we use to achieve that same result of a softened forehead. Oftentimes my male patients, because the line can be slightly deeper, I will enhance it with a little filler to smooth a little more. Still not frozen, but just soft, natural, smooth.
Okay, and so that does answer the question that you can get a treatment that involves both Botox as well as a filler.
Definitely.
At the same time.
Exactly. It's all about getting the right combination to have the desired outcome. And so sometimes we'll have Botox and Juvederm. So sometimes we'll relax the muscles and then we'll fill in the lines. Sometimes I'll do Juvederm and Voluma. I will use Voluma to enhance the cheekbone, to lift and bring back that cheekbone, but then we still will have maybe lines around the mouth that we need to soften. And so we can combine all three, we can combine two at a time. It's just a matter of kind of meeting your need.
Okay, that's really good to know. Instead of thinking, well, if I get my Botox today, I have to wait 6 weeks before I get my filler. Mm-hmm. So this is really nice. You can do it one stop.
Yes, yes.
Okay.
And speaking of 6 weeks, I do like to follow up and see you back, especially after that first time that you have it. Usually for Botox, what I like to do is to see you back in 3 weeks, because for the Botox injection, it takes around 3 days before it starts to kick in, before you start to notice that muscle is relaxing. And 3 weeks is the maximum change that you're going to get from that injection. And then, as I said before, about 3 months, especially that first time, but I see people lasting anywhere from 3 to 6 months with repeated Botox injection.
Okay. So let's talk about, what do I need to do on the day of my treatment? What should I do?
So on the day of the treatment, really you just come into the office ready to be serviced. Some people, if you're taking an aspirin, for example, that's not from your doctor, if you just take aspirin because you desire to, it's nice if you can avoid that maybe 7 days prior to the injection, just because that will minimize the bruising. But if you're taking aspirin or anything that will thin your blood for medical reasons, please continue. That's not a problem. Yes, you may have a little more bruising, but that's not a reason not to have this service done, and it certainly will not affect anything that I'm doing on the day of the procedure. With the fillers, I do like you to come to the